Hyperpigmentation is basically dealt with, they need to avoid the sun. In countries like here, like Belgium, where you have winter 6 months a year, that's perfect because people are out of the sun. But in countries like where I come from, which is Colombia, which is the tropics, where we have sun all year round, they really need to be out of the sun. So basically we tell them they need to be out of the sun, they need to wear sunblock. And the other big recommendation in post-rhinoplasty is that patients cannot wear sunglasses or glasses over their noses, especially if we've done any surgery on their bones or if we've put any grafts on their nasal dorsum, because then anything that is on top of that can alter the post-surgical result.
Hyperpigmentation, in my opinion, it causes an awful lot of anxiety for the patient immediately post-rhinoplasty, and particularly when it doesn't settle down quickly. And now, I think the most important thing for me in dealing with hyperpigmentation is actually to reassure the patient that it will settle. Hyperpigmentation can take various forms. One, it could be related to actual blood extravasation into the skin and underlying structures. And secondly, it could be related to things like sun exposure. But whichever way we look at it, in the first place, I reassure the patient, I ask the patient to sit tight, and generally it settles down. If it doesn't settle down, use of vitamin A creams or hydroxyquinone is the second line of management. Very occasionally, laser treatment, depending on what has led to the pigmentary changes, can help. And finally, the extreme cases are, it may be a coincidence where the patient has other medical problems and they have to be addressed.